Untangling Pandas and Pans is a podcast about two little-known medical disorders characterized by the sudden and dramatic onset of symptoms such as obsessions and compulsions, vocal or motor tics, and restricted eating behaviors, and a whole host of other symptoms following a strep or other bacterial or viral infection. I have the privilege of interviewing some of the top researchers and clinicians in this rapidly growing area, known by various names such as immune-mediated neuropsychiatric disorders, infection-associated neuroimmune disorders, and autoimmune encephalitis, or simply PANDAS and PANS. My name is Dr. Susan Manfull. I am a social psychologist, the executive director of the Alex Manfull Fund, and the mother of Alex Manfull, who died at 26 years old due to PANDAS, a disorder my husband and I knew next to nothing about, certainly not that our daughter could die from it.
This is bonus content for Untangling Pandas and Pans, recorded March 29, 2024.
Today, I would like to welcome Paul Murphy and Amanda Crowley to our conversation. And we're going to talk about Advocacy Day on Capitol Hill. Amanda, let's begin with you. Okay. You are one of the co-founders of NAPPA. Can you tell us what NAPPA stands for?
Great. Thank you so much, Susan. This is wonderful to be included on part of the beginning of this podcast as it gets started. And it's a wonderful idea. And I think it's going to have a wide reach. And I represent the steering committee that is NAPPA. NAPPA stands for the National Alliance for PANDAS Action. It's a group that came together in 2021 with the shared goal of advocating with Congress to advance NIH and other government agency funding for PANDAS. We are made up of a group of moms, actually, from different nonprofits and advocacy groups and state legislative efforts from across the country. We've been successful, and we hope to continue our success in the next few years. I can tell you more about that.
Okay, great. And we, as the Alex Manfull Fund, are really excited to be partnering with you on Advocacy Day at Capitol Hill.
We're thrilled to be working with you again for the second year on this Capitol Hill Day, and with Paul Murphy, who is an invaluable member of our team.
And nice to have a dad on the team of moms. I'm
great
sure.
To have a dad.
So Paul, can you just tell us a little bit about your role in this, how you came to be part of this, and then we'll get into what this is.
Sure. Thanks for having us on the podcast today. Yeah, I'm Paul Murphy. I'm out in California, and my role in the Advocacy Day, I would say, is to provide organizational support and help with the recruitment of really parents from across the country who are really interested in talking to their elected representatives about the challenges that they've faced accessing a diagnosis and treatment, and really recognition of the illness that their children's have been dealing with for so long. And that's part of my role also as the treasurer of the Alex Manfull Fund. We work in partnership supporting NAPPA's event in DC.
So we have skirted around the idea of what is Advocacy Day. Can you tell us what is this Advocacy Day on Capitol Hill? What does that mean?
I'm really, really happy that we've launched this. Last year was our first ever gathering at the national level to advocate for PANDAS with the federal government, and especially with Congress. We thought about it for several years. We had the interruption of the pandemic. And as things started to go back to more of an in-person capability, we realized that a lot of people were feeling very energized about the possibilities of speaking directly with lawmakers and people on Capitol Hill who could actually be part of changing the landscape for pandas. And doing that in person has a special meaning. I think that often families are feeling very isolated from one another and often have a feeling of powerlessness when they're in the throes of a PANDAS diagnosis. Can be an incredibly isolating and life-changing event for a family, and it often continues for many years. And we've found that the families that are gathering, that came together last year in Washington on June 2nd, had really powerful and awful and traumatic stories to tell, but they were ready to share them, and they wanted their stories to have meaning. And they found that lawmakers, staffers, people who are in the position of power in the government were incredibly open to hearing their stories and learning from them. And it felt like it was a very moving experience for advocates to be part of. And in turn, the feedback we got from people who work in the offices of lawmakers were also very, very empowered to do something after hearing from families. So I think there's something very special about being in person. I guess the meetings that children and teenagers attended were some of the most incredibly special meetings for everybody who was in attendance, because hearing directly and hearing children's passion for changing things for other kids like them was a really just incredible experience for people who were part of those meetings.
And I would amplify what Amanda said, because I sat in Speaker Pelosi's office while a teenager from the Bay Area and a couple of his friends really were the primary people to provide testimony to the Speaker Pelosi's aide. And that made the difference. That young man saying, "I'm here because I don't want this to happen to another kid."
So it sounds like just there are two primary reasons for Advocacy Day. It's meaningful for the people who attend it, for the families, for the patients, for the advocates. And
Yes.
you mentioned just simply meeting one another in person, I think is very meaningful, and to use your word, is very powerful. And then the other group that benefits, and the other purpose for having an Advocacy Day on the Hill, is so that our representatives, our congresspeople, and our senators can hear these stories about people who are suffering from PANDAS and PANS and other neuroimmune disorders. Why do we want them to hear those stories? Paul, maybe you can begin the answer to that.
Sure. I think it's whenever we talk about PANDAS, especially at Advocacy Day, it's at a macro and a micro level. So at a macro level, we're seeking funding for research. And that's obviously a very complicated endeavor given the size of the federal budget. But NAPPA provides the legislative sophistication and expertise to understand kind of where the levers are within the federal budget to increase funding for research for PANS. And funding research, again, will drive us towards earlier diagnosis and treatment of PANDAS and PANS, and more acceptance among the medical and educational community that these are real illnesses. So the primary means, and Amanda can talk more about this, is through the appropriations bill for National Institute of Health, or NIH, research funding. And then on the micro level, I just want to say, every time that one of us speaks about PANDAS, PANS, and what it is, and that diagnosis and treatment works, so every time we talk about it, we're spreading awareness. And I'll just add that, the Advocacy Day, it's really coming full circle for me, because I was born and raised in DC when I was younger, when my father worked on the Hill, and then came out to California, and I've had the opportunity to work for many local elected officials, and seen that they have taken direct testimony in their office from constituents and turned it into policy and funding and action. and improve access to really important healthcare services. And I would say that we have currently 80 people, at least 80 people planning to attend the Advocacy Day, representing, as of this morning, 15 states. So people are, spending their money, and it's important to note that if you have PANDAS or PANS in your family, all of your resources are being significantly taxed and really taken, whether those be financial, emotional, relationship. So for these parents and these families to say, okay, we're gonna spend our money, our vacation money this year instead to travel to DC to talk about this important issue, I hear them tell me, and I read them telling me in emails, it's because they know there's lots of people in their states that can't do it, that would like to. So I think that's the power of Advocacy Day, bringing people together from around the country who have shared the same really challenging experiences and communicating that directly to the elected officials who represent them.
I will just add to that, as the executive director of the Alex Manfull Fund, that Paul underscored how why Advocacy Day is so important to our organization as well, because our mission is to raise awareness, to educate physicians and mental health workers and other people who might find themselves in the company of someone who may have PANDAS or PANS, and further to support research. And we, as a nonprofit organization, cannot, and speaking on behalf of the other nonprofit organizations who also support research, philanthropy is not enough to support the type of research that needs to be done. So I know that, well, we all know that Amanda is working very hard through the Appropriations Committee to make some changes there. Can you tell us a little bit more about your work with the Appropriations Committee?
Sure. Thank you, Susan. And thank you for highlighting that important piece. We do need government funding to really accelerate PANS-PANDAS research. Private funding and philanthropy has gotten us to partway down the road. But what we hear again and again from researchers is that the way that we move the needle in big breakthroughs for PANS and PANDAS is large government grants, meaning from NIH and from other agencies that will provide many millions of dollars in research funding versus a couple $100,000. And that kind of large scale funding can provide for a very large scale study. And we need many of those if we're going to understand more about how to diagnose PANS, PANDAS, understand the mechanisms that are at play, and what treatments really work best to get patients better. And we started this process of working with Congress back in 2018. I was fortunate to attend a large conference at Columbia University on PANS, PANDAS, and met with some fellow advocates who had worked extensively at the state levels to pass legislation. One, Wendy Nawara, who is a close friend and a member of NAPPA, Gabriella True, who is another close friend and is the executive director of Aspire, another PANS, PANDAS nonprofit. And we talked briefly. I was really shocked to hear how little, how few studies had been funded by large-scale government funding. And I started a conversation with my dad. My dad is a longtime staff director on Capitol Hill, who retired and became a consultant for large international children's health organizations, including UNICEF, Helen Keller International, and and many others. And he's been a very prominent person in international children's health for many, many years. And he's worked on the Hill on the Appropriations Committee for many years. So it was a really, kind of serendipitous kind of connection to be able to say to my dad, we have this problem in the PANDAS community. Can you help us think of ways to solve it? And he has been a PANDAS grandpa extraordinaire, and has worked with us for on his own time for the past 6 years, and our process for getting, attention from Congress. It was kind of incredible. And he's hard at work right now this week. We are in the process to get ready for fiscal year 2025. And it's been a we call it a long road.
So, Amanda, for those people who are not keenly following the workings of Washington, can you just briefly explain what is the Appropriations Committee?
Sure. So the Appropriations Committee is it's the funding arm of Congress. So it's a very powerful part of Congress. Everything in our country and any U.S. spending around the world is coming from this part of the congressional process. It's a large committee made up of subcommittees, and one of the subcommittees that is specifically tied to NIH and some of the other agencies for health is the Labor, Health and Human Services and Education Subcommittee. We are in this process for PANDAS petitioning this subcommittee that's made up of members in the House and then another separate Senate committee. We're petitioning them to include language about PANDAS in their report. And at this point in the year, we're in February, March, into April. People from around the country and around the world are putting in requests for the Labor, Health and Human Services, LHHS, subcommittee to include them when they're thinking about what appropriations and what funding is going to go out from Congress in the next fiscal year. So we are writing up some what we call language, basically a short paragraph about what we're asking from Congress. This year, we're asking for $5 million in funding from NIH. It's a very small ask, but it gets us started. And we are requesting that Congress asks NIH to do more for PANS and PANDAS, including looking more carefully at how we know prevalence numbers, how we know how to diagnose, how we know how to treat PANS, PANDAS. And then NIH is asked to respond to Congress with what they're doing and what action they've taken. And that has been our process for the past 5 years. And we've been successful in getting this type of language in the bill each year, which is passed and then signed into law.
And each year that language has gotten stronger.
That's correct. Each year we've asked for stronger language, and it's just increased what Congress is asking NIH to do.
Right. So as you said, even at the most basic questions, like what is the prevalence of PANDAS and PANS? That is, how many people in this country and around the world eventually have PANDAS, PANS? Those are pretty basic questions that we need answers to.
That's right.
Paul, the people who attend the Advocacy Day can play a role here in helping NAPPA have the ear and the support of the Appropriations Committee. What will the attendees of Advocacy Day be able to do?
Sure. And let me explain the national climate around PANDAS, PANS, because I think that's important. At the state level, what we're seeing is about a dozen states where important legislation has passed to essentially require the reimbursement for the indicated treatments when a child or young adult presents with PANDAS PANS, so that the IVIG and other treatments are reimbursable through one's health insurance. That's really important because when I talked earlier about the way the diagnosis and the illness really takes from the resources of a family, paying out of pocket for IVIG, it's incredibly expensive, tens of thousands of dollars, and monthly or periodic or regular treatments are required to see the recovery that's possible. So the point is, many of these parents are already professional advocates. They may not realize that, but they are, because they've been the ones working with state legislators to craft the legislation, get it through committees, get it to the floor, and eventually get it passed. So when they come to DC, if I were to kind of portray what happens, it's really the introduction of people to their elected officials. And then it's very quickly explaining to them what PANDAS PANS is, because people don't know. And then talking about their personal experiences dealing with the illness and trying to access diagnosis and treatment. And then segueing into, here's how you can help. There's language in the appropriations bill. We really need the support of you and your colleagues to turn this into the kind of funding that will result in the research that will really move the needle towards more acceptance of PANS as an illness, and provision of that early diagnosis and treatment that can provide incredible recovery for these kids and young adults who suffer from the illness. So it's making that ask when they're sitting at a committee meeting casting a vote a personal thing. So when the vote comes up, they remember that visit and they remember that family in their district who this would help so much.
And you are providing some guidelines or some preparation for the people who attend Advocacy Day on Capitol Hill. How will you help them prepare for these visits?
Sure. So we use Eventbrite to advertise and allow people to register for the day, and that provides us with their contact information as well as their address. And Amanda provides a link through Eventbrite that lets me look up who my elected representatives are. And then we have been sending a series of weekly emails to them, and we divide people up by either their state or their region, depending on the number of registrants for each state. Then we start to talk to them about what this process is through the emails, how they can prepare. And then Amanda and NAPPA are preparing not only the folder that I'll bring, so everyone will have a folder to bring to each meeting that will include a series of documents, and then the letter that summarizes, kind of, we call it the ask of the elected official. So we're asking for your support of the appropriations bill for NIH funding. We're asking you to consider these other avenues and be aware of them as we pursue them for funding of research. And so that's what the folder is. One other way that we typically prepared last year, we'll have a Zoom training, which will be the Monday before Advocacy Day. And in that training, we'll hear from Amanda again on what is the specific ask, so people know. And then we typically have a guest panelist who might be an elected official or might be a former staffer on the Hill, to let people know this is what you can expect and this is what it's like for us as an office. And I would just remind everyone listening that, you know, your tax dollars pay for the salary of these staffers. And that isn't to be trite, or it really is the truth. So, you know, it is our capital. It is our Congress. It is our Senate. And I have found that many staffers take that responsibility very seriously because their elected officials do. Elected officials love the idea of their constituents from around the country coming to DC and seeing the Capitol and taking tours and being part of what is DC and talking to them directly about their concerns. And then I would say Advocacy Day is kicked off by, I don't know if I would necessarily call it a rally, but a gathering at the Peace Monument, which is proximal to the Senate and House buildings, where we register people, we give them their folders if they don't have them already, we get them into their groups, and then we hear from Amanda and others for a few minutes about why the day is so important. And, that's where you see this kind of magic of people meeting for the first time. Now, maybe for the second time, they met last year. But how do you quantify the value of a parent from the Midwest for the first time meeting another PANDAS PAN parent, where they've been operating in isolation forever until that day, until that advocacy day? I describe that because that's the energy that we bring to Advocacy Day. And we only have to look at other diseases or illnesses and the progress that's been made to understand why this is so important. And I think the best example is probably Lyme disease, an illness that for so long people suffered from, and people wouldn't even believe that it was real. People were told it was something else or not treated, or their voices weren't heard even when they were expressing them to their physicians. The incredible amount of federal funding that has been allocated to Lyme research has made all the difference. So that's our North Star, is that we see a day where NIH and CDC and other parts of the federal government will significantly fund research, education, outreach around PANDAS PANS. And when a parent notices that their child has this immediate onset of these very confounding symptoms, like all of a sudden my child has obsessive compulsive disorder, they never had it before, but I remember that they've had like strep 3 times. So I'm in the emergency room, or I'm at my primary care physician's office, or I'm even in a psychiatric setting. And those treating physicians have PANDAS PANS on their mind, something to at least rule out. Then we'll know that these advocacy days have made the difference. That's how I would summarize it, Susan.
I think for anyone who's on the fence about attending, that probably pushed them over. It really is a magical day. The energy is palpable there. And I recall talking to a couple from Ohio last year after they had gone in and spoken with their representatives, and they were moved to their eyes welled up with tears. They felt that they had been able to play an important role in making changes at the legislative level, and that will eventually lead to changes at the medical level, beginning with medical schools, I hope, to change the education so that the role of the immune system, the role of infection are all better understood in the roles that they play in the development of neuropsychiatric disorders like PANDAS and PANS. So, Paul, am I correct that you're also having a meeting on Thursday in DC?
Meeting's a generous term, and a lot of people are, say, flying in, and we just thought it would be nice for them, especially if they have kids, to know where they're going to dinner Thursday night. So we've reserved an area at a restaurant that's very close. I think it's 1 block from the host hotel that we've selected for people to come and stay at if they'd like. And that'll be another time for people to meet for the first time. We start that personal convening as early as possible, and they can get organized for their meetings. Of course, we're creating a master list of all the meetings that are being scheduled. And I would say that while we reach out primarily to the elected officials for whom we're constituents, so my congressman, I've found that offices from even other states, I mean, I grew up in DC and then Rhode Island. I have an appointment scheduled on Advocacy Day for a congressman from Rhode Island. So people want to hear from voters. They want to hear from people that are making this trip.
Right. So I have the benefit of being able to see the background of you, Paul, and you have a green shirt back there. Can you tell us the role of the green shirts on Advocacy Day?
Sure. It's typical when groups go up to the Hill together that they have a T-shirt or they choose a color so that there's a unifying theme, and we've chosen green. We have great images of the Capitol or the White House, and we weave those through the various events that we have in DC, especially the 5K race that I think you'll be talking to Marina more about. And I wanted to extend that that image, or that what you talked about with the family, because the last three people to run through the finish line of the 5K last year were two parents and their younger child who suffers from PANDAS and PANS. And the crowd that cheered her on as she crossed that finish line and awarded her medal, I just thought that was a great metaphor for kind of what we're trying to accomplish in DC, kind of this convening and this recognition that you're having challenges now, but there is a path through diagnosis and treatment to recovery, and you and your family aren't alone in trying to make that happen for you and for everyone that follows you.
So well put. It is 36 hours in DC. That's one of our taglines, because we do begin with Advocacy Day on Friday morning, April 12th, and we wrap up with the Alex Manfull Fund 5K Saturday, April 13th at Haynes Point in DC, a beautiful spot. I was just there a couple of weeks ago walking the course. So the 5K that Paul just mentioned is an awareness event, and it's also a fundraiser event, because these kinds of events, and as well as the other awareness events that we have throughout the year, the education events that we have throughout the year, including a symposium for physicians and other mental health care workers, legislators, policymakers. That symposium, we will be having our third symposium in Portsmouth, New Hampshire in November. And those things all have a price tag. And needless to say, research has a price tag. We just funded two major research projects. One that will be conducted by Dr. Kyle Williams, a psychiatrist with the PANDAS Clinic at Mass General Hospital, doing some fascinating research on the role of IL-17 and OCD. And then we also just supported some research by Dr. Lauren Breithaupt, who is a psychologist also at Mass General in the eating disorders department. She is doing some basic research to find a biomarker for PANDAS and PANS. And I would like to mention that we had contributions from the Louisa Adeline Johnson Fund for Complex Disease, and also the Neuroimmune Foundation, for which we are very grateful. Amanda, backing up just a little bit, it's correct to say that you started a lot of this advocacy work in Massachusetts. Can you tell us a little bit about what's going on in Massachusetts and the success of the advocacy work there?
Yeah. Yes, our Massachusetts, we call it the Massachusetts Coalition for PANDAS, and it's a huge success story. The group that came together to pass the bill that was signed into law in 2021 was just a really inspiring group of parents, and I can't be more grateful for having met them and worked with them. This is a group led by a very special friend of mine, Sheila Gouch, and another very special friend, Jennifer Vitelli. They just worked completely tirelessly, made connections with almost everyone in the Massachusetts legislature. I mean, it was just the groundswell that came from their meetings and their contacts passed something that no one ever thought could be done, which is insurance mandate, mandating coverage for PANDAS treatment in a state that hadn't passed an insurance mandate in 8 years, and especially not a mandate for something as not well known as PANDAS. So Massachusetts had never seen, the State House had never seen such a large gathering of a grassroots group. Usually there's a large backing from lobbying organizations, and none of that is true for us, including with our upcoming Capitol Hill Day. We do not work with a large lobbying group at all. We're just, and we actually don't have any funding at all for this. We're all doing this on our own volition, because we think it's really important, and because we've seen the ability to make change, and we've seen the doors that have opened with laws that pass, and it's important to a lot of us. We don't have time to wait for the science to catch up. In a lot of cases, scientific research and change at a macro level, with scientific discoveries being translated into patient care, can take at least 10 years. We're all working with our kids now, who are in some cases still really fighting for their health. And so the quicker we can move the needle, the better. And we found a way to do that with welcoming and willing lawmakers by our sides.
Thank you. I just to underscore, this is a treatable disorder, and the earlier this disorder is identified, is diagnosed, and treated effectively, the better the prognosis is. I think that's really important to remember. And I think it's also worth underscoring that what you did in Massachusetts is what California hopes to do with AB 2105. Well, I think that we've probably covered just about everything. And in any case, we're running out of time. All right. Any last short words from either of you?
I'll put in a plug for VA for PA, which is the Virginia group that's really been another inspiring state-run grassroots effort to pass legislation in Virginia. And a lot of our fellow advocates from Virginia will be joining us on our Capitol Hill Advocacy Day.
Absolutely. Thank you, Amanda. I was remiss in not mentioning the Virginia group, several of whom are on our board, and they're doing a phenomenal job. And I'm confident that they will be successful in making insurance coverage available to those with PANDAS and PANS in that state.
All right, we got to give a shout out to California then too, because we have, I think, 9 or 10 people making the furthest trip. So if it was a wedding, we'd get the prize. And they, the California PANDAS Advocacy Group have been incredible supporters of the Alex Manfull Fund, the 5K, and the Advocacy Day.
Absolutely. Well, then I guess I'll put in a plug for yet another group who actually would get the very top prize for traveling the furthest. And that is Expand, the European group that the chair is Renee Accra, and she is bringing her mother here, and her mother is coming from Alaska to be here on Advocacy Day and visit her representatives in Congress. So I think we're going to have a great crowd, and I'm incredibly excited about being there. And I hope everyone will stay on and go to the 5K, because as Paul said earlier, that's also a really moving event.
And Susan, could I just say that if it comes down to the wire and you're not sure whether you can make it on a given day, I know that that's the case, especially if you live locally in the DC area, and you may have a child that you have to just decide the day of, right, whether you can join. We welcome you. We welcome you to just show up. We'll have lots of extra folders. There's plenty of opportunity to stop by offices, even if you don't have an appointment. And we welcome you to join us even last minute, even if you come for an hour. And we're going to take a big group photo, and that'll be a lot of fun. My son likes to carry around the bullhorn and organize everybody. So he'll probably be doing that again. and it's got a festive atmosphere. So we hope that you show up, even if it's a last minute call. We'd love to see you.
That's right. So Friday, April 12th at the Peace Monument at 10 a.m. And we'll be there early, but all are welcome.
And lest I forget, if you are unable to attend, you can, the Advocacy Day or the 5K, please consider participating virtually and send us a photo and we'll put it up on our Alex Manfull account of you wearing a green shirt, wearing a green scarf on Advocacy Day, or participating in your own way on the 5K. All right, thanks very much, Paul Murphy and Amanda Crowley, for enlightening us today. Thank you.
Thank you.
For more information about PANDAS and PANS and the Alex Manfull Fund, please listen to the following 1-minute public service announcement and visit thealexmanfullfund.org.
Hello, my name is Terry Downing. My daughter Tessa waited far too long, 13 years ago, to be diagnosed and treated when she began to suffer from a disease called PANDAS. PANDAS stands for Pediatric Autoimmune Neuropsychiatric Disorders Associated with Strep Infections. Yes, strep throat. Tessa is forever damaged because of her delayed diagnosis. But there is hope, and she is a hero in my eyes.
The Alex Manfull Fund is an organization created by two parents who lost their daughter Alex to PANDAS. Countless doctors failed to recognize Alex's condition in the 7 years after her obsessions and compulsions began following a bout of strep. Early diagnosis and treatment saves lives, so they created the Alex Manfull Fund. The fund supports important research like the Georgetown Brain Bank and education about PANDAS and PANS. Parents have begun to recognize PANDAS in their children and are accessing an accurate diagnosis and treatment more and more. To learn more about PANDAS and PANS, please visit www.thealexmanfullfund.org.
The content in this podcast is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition.